Let's get more of this from Chris Roebuck, who's a visiting professor of transformational leadership at Cass Business School, London, and has worked with several leading international organisations, including the NHS. First of all, are you surprised at this report, the depth of fear that has been nailed here?
Absolutely not, because one thing we know about large organisations is the NHS, there are hundreds of thousands of dedicated people who want to give the best patient care. But statistically in there are a group of people who want to protect their own reputation and want to protect the system at all costs. Now, what we know is that over a number of years, if those people get away with it, their behaviour becomes more extreme and more people join them. And that's what's happened with the NHS. So we've got into a position where in certain parts of the NHS, absolutely outrageous behaviour has been tolerated because it's seen as common practice. And we're talking about behaviour in our National Health Service that is actually as bad, if not worse, than the toughest treatment of whistleblowers in the commercial sector.
Well, I was going to ask you that. I mean, presumably it does happen in the commercial sector as well,
yes.
Does it? But you're saying it's worse than the NHS?
The level of intimidation within the NHS has been greater than, generally speaking, within the commercial sector. To some degree in the commercial sector, if you don't like your employer, you move to another employer. The way it works with some of the whistleblowers in the NHS, they were effectively told it doesn't matter where you go, your career in the whole NHS is over. Now, that's not to say that there aren't islands of excellence in the NHS, and it's only in a few places where this has happened, but it has been very bad. The challenge is it's not just protecting whistleblowers, because the impact on the whistleblowers has been significant, but then there's a knock-on effect with the people around the whistleblowers who see them being treated like that. And that means that everybody starts thinking, hang on, no, I have a concern, but I mustn't raise it, otherwise I'll be intimidated as well.
Well, you're talking then about a change, a cultural change, which involves a different type of leadership. People saying it's okay for you to say we've got this wrong.
Absolutely, and that's the answer. It's not just about saying we will protect whistleblowers. It's about changing the whole culture of the NHS. And in many places there is a positive culture, and in many places people are encouraged to say, I think we could improve this, or I have a concern about this. But there are still a lot of places where people, because of what's happened before, are frightened to speak out. Just saying we protect whistleblowers is not enough. The NHS needs to utilise, in particular, some of the things that the commercial sector utilise to turn around the culture as quickly as possible. The problem is that the NHS isn't one organisation. There's hundreds of trusts, and therefore it's getting all of those individual trusts to work in concert to create a new atmosphere.
But presumably, to go back to what you said at the beginning of our conversation, you talked about pools of excellence within the NHS
yes.
and so on. So there must be some places in which it is relatively easy for you to go to your boss and say, I don't think we're doing this right.
Absolutely.
Why can't other places replicate that?
One of the problems is the way the NHS is now structured. This is a problem in terms of clinical excellence. It's in terms of leadership excellence and all of these things, because there are several hundred trusts, many of whom have their own chief executive, many of whom do their own thing in their own way. And sometimes, they keep reinventing the wheel. So the idea of how you spread and embed really great inspirational leadership that positively encourages every single employee to say, we could improve, or I have a concern, is a challenge. And commercial organisations find that this can take them 3, 4, 5, 6 years, even with a concerted attempt to change culture. So the NHS does have a challenge, but it must recognise that it's not just about protecting whistleblowers, it's about changing the whole culture to create inspiring leaders who encourage world-class performance everywhere, not just in a small number of places.
Chris, thanks very much.
Thank you.
Chris Roebuck there.